This week we're talking about ankle sprains and what we can do soon after the injury to start the treatment process. But first, our disclaimer. Dr. Mike Matthews, physical therapist here with the PT411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also, make sure you check out thept411.com. So like I said, this week we're looking at the ankle again. We're looking at these ankle sprains. Last week we looked at the same process, the same screening tool that ERs use to determine if it's even worth their time to do an x-ray. They do this screening tool because most people that come in with these ankle sprains, in fact, do not have a fracture. Only very few do, and they don't want to expose people to the radiation if they don't have to. So if you haven't seen that video, go check out that video first. So let's say we did that ankle sprain. We've gone through the screening process. Doesn't look like there's a fracture. If we went to the ER, they give you a band-aid, they ice it down. That's about it. Now we're stuck with this ankle sprain. Well, what is it? An ankle sprain or sprain anywhere in the body has to do only with the ligament. A sprain is an injury to a ligament, and a strain is actually an injury to a muscle or tendon. So let's look at some of the main ligaments of the foot. And we're looking at three main ligaments, each on the inside and outside. First, we're looking here on the inside, the medial side of the ankle. We have these three ligaments here, and these ones aren't going to get injured quite as often as the outer ones because we don't roll our ankle inward as much. Depending on which way you roll your ankle will depend on which ligaments gets overstretched there. And it also depends on if our foot's more forward, more neutral, or more dorsiflexed up this way, on which ligament here is going to get the most stress, or multiple ligaments rather. But since we don't roll our ankles in much here, we'll look at it from the other side. The outside here, we got our three ligaments on this side as well. Most of the time it's going to be your most forward ligament right here, this forward one, your ATFL, because most of the time when we roll our ankles inward, it starts to point downward as well. And the thing about these ligaments here is they're supposed to prevent movement. They're supposed to prevent excessive movement from happening, but the problem is sometimes that movement, it gets a little too excessive, a little too forceful, and it pulls too much on the ligament and it injures it. And these sprains can go anywhere from just a mild stretch that overstretches it a little bit to partial or full complete tears as well. So we also have to make sure that anytime we injure these, that these get diagnosed correctly. Most of the time, we don't get complete tears. Even if it's just a partial tear, we have a pretty good chance it's going to heal on its own. So right after we injure our ankle, the first thing that happens is swelling, inflammation. Things have to start healing. Now, swelling and redness does not necessarily mean it's a very bad injury. All it means is that there is an injury and things are starting to heal. We definitely want the process to run its course, but we also want to make things manageable for ourselves. We can ice it down just to manage the inflammation, just so it doesn't get a little too far out of control. And the ice will also help to numb the area so that we can better deal with the pain. The other thing we need to do, we just injured it, it does need a little relative rest. When I say relative rest, we don't want to completely baby it, completely get off our feet. We need to keep it moving, but we definitely need to tone it back from our normal activity level. Don't be afraid to put weight through it. If you absolutely can't put weight through it at all right after the injury, or if you can't take 4 steps 30 to 45 minutes afterwards, you definitely need to get an x-ray. But outside of that, we just need to get a little relative rest. But very quickly, we got to get things moving again. We can't let it rest too long. We got to get it moving. Yeah, we do have an injury. We do have injured tissues. But the big thing is if we don't start stressing things, it's going to tighten up. Things are going to get worse, and we're going to get more and more sensitive, and things are going to get more painful instead of less painful. So we got to get it moving within a couple of days after the injury. So the first thing we want to do is get this foot on over here. Get it propped up on something, foot off the edge of a bed or other sort of surface. We got to get it moving. We're going to go through just some active range of motion here. No added resistance or anything at the moment. We just got to start off with some ankle pumps going up and down. We can also work it going side to side here, and we can work circles in each direction. Do these movements a few times a day, really get it desensitized to movement, because we want to progress this thing along as quickly but as safely as possible. So make sure we can tolerate these things. Go through as big of a movement as you can that you can still tolerate. Discomfort is fine. We don't want you having any excruciating pains where you're killing yourself with it. As that gets easier, we can get a resistance band and put it around this foot here so we can start working a little bit more resistive movement. I'm not using anything too heavy right now. We're gonna work our same motions. We have up and down with the resistance coming up. We can do is wrap it around the other foot and have this side bent and that other side straight. You can work that resistance coming up and down, coming over this way, working at it for going from side to side, holding onto the weight this way, and crossing it over this way to work it going inward here. Now, if we don't have a resistance band here, we can also do resistance just using our hands. For that one, we need to cross over our foot here, and we just do the same movements here using our hands as the resistance. So we have our pushing down, pulling up, resisting it going inward and outward there. Now, the other thing we need to start doing is desensitizing it to weight bearing. We might not be able to put full weight through it for very long, so we need to start building up that endurance as well. So we need to stand up, shifting as much weight as we can onto that side there. If we can bear full weight, we want to pick up our other foot, work on balancing here. If not, just do as much as you can tolerate, but we want to really quickly progress us to doing just one foot on there. You're gonna hold this here, typically work on 30-second sets here. We can even work on it starting from the front to put weight through it, to accept that weight like when we're walking. Put weight through it there, try to hold our balance there. Same thing, we can do 30 seconds from going from the front. We can even do it going the other way. So stepping backwards onto that foot, grabbing that balance and trying to hold that there. We can also start to do some heel raises and toe raises and standing here. Raising up onto your toes here, holding just about a second each time you get to the top. So we can do that. Show you from the side, just coming up and down here, nothing too crazy there. Same thing, rocking back onto our heels, holding 1 second at a time there. That starts to get easier. We can do it from a more elevated surface. Starting off with both feet. Here from the side again. That way we're not starting just from that neutral position. We're starting to go from a more elevated position with our toes and up. And the same thing on the other side here. Toes are starting more down and raising up here. Progressing from there to 1 foot. Both from here and from here. And there's a whole bunch of ways that we can work on progressing this to make this much more difficult. The thing is our ligaments are only part of the equation. With stability in any part in our body, especially our ankles, there's other things that we can do along the way to take pressure off that ligament a little bit as we progress things along, and also to facilitate the healing process of that ligament. The next several videos, we're going to do just that, looking at ways we can increase stability in that ankle. So make sure you stay tuned for those. Again, I'm Dr. Mike Matthews with the PT 411. Thanks for joining me.